You.
All right. Thank you. Thanks so much for having me. Hi, everyone. I'm Ilana Sherman. I am the Director of Education at Erika's Lighthouse, and I'm really honored to be here today and join you and share a little about Erika's Lighthouse and our help-seeking study. And we're going to get started. If you have questions, feel free to type them into the chat. And Arlen, you can just let me know if there are questions, or at the end, we'll save time too. Great. All right. I'm going to share my slides here. So everyone should be able to see that. Great. All right, so let's get started. So the title of our presentation today is Youth Help Seeking Around Mental Health, Using Data to Improve Mental Health Education. And you'll see a QR code on the screen on the title slide right there. And that QR code is going to bring you to a page on our website, our meaning Erika's Lighthouse website, where you can make an account to access resources. I'm not going to talk so much about all of the resources that we have today, but I do want to let you know we have lots and lots of free resources. They're all free resources on mental health, depression education, and suicide prevention for schools to utilize with their students, their staff, and their families. You are welcome to make an account and access and use those resources as you please, but you do need to make that account. So that QR code will bring you to that. I'm going to keep moving on. I will share the link again and make sure that you all have that in case you didn't get it quite yet. So I wanted to introduce myself a little bit. I am, like I said, the Director of Education. I've been with Erika's Lighthouse for about 6 years now. This is my 6th year, and it's a job I'm passionate about and love, and I really enjoy coming to work every day. I live, for those who are in Illinois, I live in the northern suburbs of Chicago, up in Highland Park, Illinois, right on the lake. It's a beautiful place. I grew up not too far from here in Evanston, where Northwestern is. I have a background in health education. For my master's degree, I came back to Illinois and went to University of Illinois at Chicago and got my master's in public health. 2 things that I've been sort of into lately is one, my sophomore son, who is about to turn 16, has been on the golf team for the past couple years. So I have been learning to love watching golf. I'm not very good at it at all, but I really enjoy watching golf and watching him play. And I'm learning more about the scoring and all the strategy that comes into play. And then I love to travel. I was able last year to go to Portugal with my dad on a bike trip, which was pretty cool. And then a couple years ago with my son to Italy, which we both loved. To take care of my mental health, what I like to do is really take a lot of walks with my friends, hang out with my friends, and definitely have my morning coffee. That's important. So where I work with Erika's Lighthouse, we are a nonprofit organization. We were founded about 21 years ago after the loss of a girl named Erika, an 8th grader, 14 years old, who died by suicide. She had been diagnosed with depression for about a year. And after what happened, her family, while grieving, really wanted to get some education into the middle school. Her friends were saying that this topic of mental health and suicide and depression was something they didn't talk about. They wanted to, but there was just a bigger stigma that existed back then, 21 years ago, that does now. And so they started with some education in the middle school, and it slowly grew to other schools and other communities around the Chicago area. And then we grew much larger, and we are now an international organization providing programming to any school anywhere. That's really our mission, to provide free programs, free mental health education programs to any school anywhere. And we're really proud of the work we do. We have a lot of great resources for you to utilize, and they make a positive difference, which we're going to talk about today. So when I talk about our programs, this is our program model. And in the center, you can see 4 different colors. These are what we call our 4 pillars: classroom education, empowerment clubs, family engagement, and school policy and staff development, Within each of those pillars, we have different programs and resources that you are able to utilize with the different groups in your school, whether it's students, their families, or your staff. Around our 4 pillars, we have our program, sort of our supports. We have our data center to get up-to-date pre and post-test results that you might utilize. We have our strategic alignments, we have a culture framework, and we have our school-wide campaigns. And these really help to build that inclusive school culture around mental health. So, you know what? I'm gonna just 1 second, pause this for 1 second because I forgot my little notes there. Okay, hopefully you can still see. Okay, I'm sorry about that. So you've seen this before, probably, the MTSS. And MTSS is a framework that many schools are using. It's a framework really of tiered instruction and interventions that ensure that all students receive the appropriate academic, social, emotional, and behavioral supports they need to be successful in school. So at that tier 1 level down in the purple, tier 1 is all students should be provided universal, high quality instruction. And this is where Erika's Lighthouse fits in, where our programs and resources really fit. We consider ourselves a tier 1 early intervention, early prevention program. When tier 1 is working effectively, 80 to 90% of students should make expected progress. Then we have tier 2 in blue. Tier 2 interventions are typically provided to 10 to 20% of students who are not making expected progress with tier 1 programming. These interventions are usually provided in small group settings. And then we have tier 3 on the top. Tier 3 interventions are intensive, individualized interventions for students who did not meet the expected progress in tier 2. When the MTSS system is working effectively, fewer than 10% of students should be receiving tier 3 interventions. So I show you this just to explain a little about where we're coming from and our approach at Erika's Lighthouse. Like I said, we are a tier 1 program provider of resources for students, staff, and families, and focusing on prevention and early identification. We take a really upstream approach that depression education is suicide prevention. And doing that helps to build that inclusive school culture and break down stigma. So today we're going to talk about the youth help seeking around mental health study and the results that came about that I wanted to share with you. So let's talk about why we're here today, why improving youth mental health is a top priority for schools. We see a growing problem. From the latest CDC Youth Risk Behavior Survey data, we know that 40% of students have experienced persistent sadness or hopelessness in the past year, a significant increase from 30% in 2013. The reality is that over 90% of individuals who die by suicide have an underlying mental health condition. Suicide is the second leading cause of death for youth ages 10 to 18. We know that there are vulnerable groups when it comes to elevated suicide risk, and those include Indigenous youth, female youth, LGBTQ+ youth, and youth of color. And we're here today because we know that there is power in early intervention. Early identification and intervention are crucial in preventing suicide. Encouraging youth to seek help from trusted adults and fostering open conversations about mental health are key steps. So to conduct this study, we surveyed a diverse group of students in grades 5 through 12 across the US who participated in Erika's Lighthouse Level 2 and Level 3 classroom programs. This is data from our past 3 school years. Both pre and post test, or I should call them pre and post program surveys, were administered to a total of 18,077 students in 515 schools. This diverse sample includes students from various socioeconomic backgrounds, races, ethnicities, geographic locations, representing both public, private, and charter schools, in urban, suburban, and rural areas. To measure the impact of the program on student help-seeking behaviors, we focused on two key questions from our pre- and post-program surveys. We asked students to identify a trusted adult with the first question, which is, which of the following are examples of who could be a trusted adult? And they selected all that apply. Then we inquired about students' comfort level in discussing mental health with a trusted adult with the question, I would be comfortable talking with a trusted adult about my mental health, and select all that are true. Again, the programs we used for these pre- and post surveys were Erika's Lighthouse Level 2, which is titled Depression Awareness, and Level 3, titled Depression Education and Suicide Awareness. Those two programs, which are typically more our middle school and high school programs. And here's a chart with the results. And I'm going to dive deeper into each of the 6 findings that we have. At a glance, take a look at the first question on the left. All of the post-program percentages saw an increase after students received the program. On the right side, you can also see an increase in the comfort level students had in talking with a trusted adult after the program. So overall, very positive. So let's take a look at some of the findings. Finding number 1. Universal programs that impact every student in a school community, otherwise known as those Tier 1 programs, are vital and effective in supporting youth help-seeking around mental health. Students reported an increase post-program in identifying those who could be trusted adults. You can see these increases on the left side of the screen. Recognizing that any adult could be a trusted adult is very important, and our programs positively impacted that. Now, while identifying potential trusted adults is important, students must be comfortable talking with them. The findings represent a substantial increase in the student's comfort level in speaking with a trusted adult about their mental health. We see an increase in speaking with adults at home, but here's where you come in to make an impact in a school. 12% of students were more comfortable speaking with a trusted adult at school after completing the Erika's Lighthouse program, while 10% were more comfortable speaking with someone in the community. What we see is that our programs helped young people be more comfortable talking to an adult about their mental health, but it's also more likely the program promoted increases in a student's ability to identify new trusted adults. Our second finding focuses on gaps that we identified. There are significant gaps between who students know could be trusted adults and who they're comfortable with talking about their mental health. For example, 96% of students identified a parent or a grandparent as a trusted adult, but only 77% said they would be comfortable talking to a trusted adult at home. So there's a 19% gap there. Now, a greater gap exists with help seeking at schools. After the programs, 93%, 92%, and 86% of students identify a teacher, a counselor, or a coach, respectively, as a potential trusted adult. However, only 50% would be comfortable speaking with a trusted adult at school. One of the reasons we encourage school-based prevention programs, such as Erika's Lighthouse, is because these programs have a positive impact in helping normalize conversations and build school connectedness to demonstrate that to students that adults in their schools care about them and want to support their mental health. However, a 42% gap remains. Lastly, supporting student mental health in the community through trusted adults is a particular concern. Students can identify community-based adults as trusted adults, with 86% selecting a coach and 79% a religious leader. However, only 28% are comfortable speaking with a trusted adult about their mental health. Finding number 3 showed us that while the majority of students can identify a potential trusted adult, there are still students who don't feel comfortable talking about their mental health or don't have a trusted adult in their life. We saw a 23% decline post-program in students uncomfortable talking with a trusted adult about their mental health. However, for those students who were not able to identify a trusted adult, we saw no change post-program. I know this is tough to hear, but we need to recognize that this makes us focus on the importance of building those relationships between the adults in your building and the students. Finding number 4 focuses on a comparison between Title I schools and non-Title I schools. What we see here is that compared to non-Title I schools, students in Title I schools overall had a lower identification of trusted adults pre-program. A student in a Title I school was 7% less likely to identify a teacher as a trusted adult, 8% less likely to identify a counselor as a trusted adult, 14% less likely to identify a coach, and lastly, 15% less likely to identify a pastor, rabbi, or religious leader as a trusted adult. Now, after the program, Title I schools saw a slightly higher impact in identifying trusted adults. What we see here is that we're helping to close that gap between student populations. Finding 5, we compared data from predominantly Black, predominantly Hispanic, and predominantly white schools. The numbers you see here are the difference in students' ability in predominantly Black and Hispanic schools to identify a trusted adult compared to predominantly white schools. As you can see, they are all lower percentages. The good news, after the programs, the gains students received were more substantial for students in predominantly Black and Hispanic schools, again, closing that existing gap. Our last finding focuses on the importance of families as trusted adults. Parents and grandparents are students' most identified trusted adults at 96%, and the home is where over 75% of students are comfortable speaking about mental health. This is by far the most important group of young people for young people to turn to if they are in need. Now that we have all this data and the findings, I have some recommendations for us to improve Tier 1 mental health education and practices at your school and for your students. One clear example is to implement effective education and prevention programs around mental health, depression, and suicide. From this study, the impact of short-term education is clear. Students can be educated about mental health and taught the skills needed to identify and speak to trusted adults. Tier 1 universal programs that impact every student and stakeholder in a school building are a powerful way to alleviate the current youth mental health crisis. This programming needs to be consistent, where every grade is presented with age-appropriate materials and supported through boosters throughout the year. Not a one and done, just check off, not a one and done. At Erika's Lighthouse, we have free programming going from 4th all the way up to 12th grade. All of it is video-based, bilingual in English and Spanish, and ready to be implemented. Now, between July 2024 and March of 2025, we gathered survey data results from Erika's Lighthouse Classroom Education, our pre and post program surveys. After learning from Erika's Lighthouse, 93% of students believe we should be talking about mental health. 89% of students reported achieving a key learning objective, that being mental health literacy. 11% increased their comfort in speaking with an adult about their mental health. And 92% of students believe that this program is important and helpful. Our second recommendation is to go deeper. Our study data is focused solely on implementing our classroom education programs. However, we believe many of the results can be even more significant when coupled with other impactful programs within school communities. At Erika's Lighthouse, we have 4 pillars, which we believe are crucial to creating those school cultures around mental health. I mentioned these earlier with the program model. Good mental health clubs, we call those empowerment clubs, family engagement resources, and staff training. Other wraparound supports include a data center to continue monitoring program results and effectiveness. Students need us to create opportunities and spaces to have peer-led initiatives promoting good mental health, help seeking and identifying prospective trusted adults. Peer-led initiatives such as empowerment clubs is one way to practice all those skills learned in the classroom education programs. For families, we need meaningful, easy to share resources, easy being the key word. We know that many buildings struggle with communication with parents and families and caregivers. We need to support families and meet them where they are. Erika's Lighthouse has bilingual, downloadable, and easy to share workbooks, pre-recorded workshops, as well as a do-it-yourself prepared workshop for in-person events, and templates for easy communication. When we are encouraging students to identify trusted adults, we must support all school staff to feel confident in being those trusted adults. Staff training is available through Erika's Lighthouse. We have an asynchronous on-demand session that provides a certificate of completion through our LMS system, as well as the training available to be implemented by a school representative in-house. We also have staff well-being activities, which help support good mental health and inclusive school cultures. Lastly, we have our school-wide campaigns, which help maintain the school culture, establish values and vocabulary, and they also highlight mental health through weeks, such as Suicide Prevention Week, or months like May for May Mental Health Awareness Month. So speaking of staff training, these are the results from between July of 2024 to March of 2025 regarding our staff training. Just to show you a quick, some quick results here. 98% of staff believe we should be talking about mental health. 97 reported achieving a key learning objective, mental health literacy. 97% of staff identify as being a young person's trusted adult, and 98% are comfortable talking with a young person about changed behaviors. A 5 and 16% increase in agreeing and strongly agreeing, respectively. Our third recommendation is to respect student voice. Schools should leverage programs that represent the diversity of their student bodies. Students respond positively to hearing stories and seeing peers that look like them. This can be especially true for underrepresented students who have historically had less access to culturally appropriate mental health resources. Students should also have a role in appropriate leadership committees and on task forces that determine school policy and program implementation. Students, particularly those in Title I schools, need additional connections to trusted adults. Community-based organizations like after-school programs or sports clubs can play a vital role in advancing conversations around mental health. Erika's Lighthouse has created a series of turnkey programs that community-based organizations can easily implement. Our next recommendation is that community-wide approaches are essential to supporting young people from early childhood and beyond. And these should include high-quality prevention programs, such as Erika's Lighthouse, strong referral networks, shared values and vocabulary, and widely represented participation. Our sixth recommendation is to focus on diversity and representation. Recognizing and celebrating and including differences in the programs we are bringing to schools is very important. While every young person is different, so is every classroom, community-based program, community-based organization, every school, professional, and family. So we need to give space to incorporate each of those voices. And next, we want to focus on partnerships. School-based programs have a unique opportunity to help identify gaps in their own offerings and foster impactful partnerships that can help fill those gaps, improve their own efforts, and improve school cultures. Partner with organizations to support meaningful alignments. Our last recommendation focuses on families. It's important to recognize that families are young people's most identified trusted adults, and that most students are comfortable talking about mental health at home. Schools need to encourage good mental health practices and provide families with tools to support their children's mental health. The most powerful tool I can leave you with today is our data center, which is where you can collect data from our school culture survey, our Tier 1 mental health assessment, our pre and post data for students, which is our classroom education and clubs, pre and post data for staff training, and pre and post data for family workshops. Once you have a resource portal account, you will get access to your school data. If you use our pre and post or any of the surveys, you will get access to your school data and even may be able to see your district data. A great way to start using data to improve mental health education is by completing our Tier 1 school mental health assessment, which will assess your current practices and provide you with recommendations where we identify gaps and areas for growth. So that's our QR code to bring you to the Tier 1 mental health assessment. And if you missed this, or it will also be on the resource portal, which I'll give you the link to. And speaking of the resource portal and how to access some of the things that I've talked about today, our classroom programs, our staff training, our family resources, we have here our website, ericaslighthouse.org, and that's Erika with a K. If you go to that website, in the upper right corner, there's a button that says register for free access, and that will bring you to a form that you can fill out to give us your information, and we will then send you an email with a username and a temporary password. You'll then open that email and use that temporary password to log in. So you can see the login button on the upper right as well. So again, click on the register for free access in the upper right corner. That QR code on the screen right now, if you'd like to use your phone, that will bring you to the form as well. So again, we believe at Erika's Lighthouse that everyone deserves good mental health and free mental health. And we are really on a mission to provide that to any school anywhere. I am happy to speak with you after this and answer any questions you might have. You're welcome to email me. That is my email on the screen there. It's a lowercase I-L-A-N-A at ericaslighthouse.org. Thank you so much. And let's open the floor for some questions.
All right, Ilana, thank you so much for sharing the importance and all that data around youth mental health and the wonderful recommendations you all put together at Erika's Lighthouse. Definitely recommend checking out their resources, using those QR codes to get access to their learning management system. All would be great and important next steps. Oh, and Ilana put her email address and their website into the chat. So if you want to open those things up, get that saved. We'll now open it up to any questions we've got in the room for Ilana. You can type them into the chat. Make sure that we can see them. You can still post it to everyone so that we all see your questions. And we'll have a little time for Q&A here.
And we also have all of this help-seeking data on our website as well, if you wanted to take a closer look.
And if you've got no questions, you can type that into the chat as well. Let us know if you have no further questions and any comments or feedback for Ilana. Like I said, I'll be sending out the link to the evaluation tomorrow to get your formal feedback on the webinar. Any ways that we can improve and do better for the next time, we always appreciate and are open to that feedback. All right. Thank you, Wendy. Appreciate you joining.
Thanks, Wendy.
All right, I'm going to go ahead and stop the recording.